And welcome to The Factor Uncensored. Thank you for joining us tonight. Now, today, we start our show off talking about a plastic surgeon that was doing too damn much. Dr. Roxanne Groff is accused of botching procedures and performing Brazilian butt lifts while live streaming on TikTok. After multiple warnings from state officials, the doctor has been stripped of her medical license and is being sued by 3 of her former patients for botched procedures. Tonight we talk about that thin line with doctors posting educational and entertaining videos versus those who go too damn far online. We have with us plastic surgeon Dr. Cuddy and Dr. Abdullah Kudrath. Welcome both of you to The Factor Uncensored. When you see stories like this, Dr. Cuddy, and you were here just last week warning us about those who are not able or not an expert at doing plastic surgery doing it, but now you have individuals who are on social media, distracted, looking for likes. Your thoughts on a situation like this when a doctor, and she was warned by the state board 2 or 3 times to stop, and she did not.
Yeah, this case involved a few different issues. One of them was what the medical board had been telling her about stopping what she was doing. In that case, it was related to privacy. And what I think was probably happening is that she was doing things like live streaming or using photographs without the patient's explicit permission to do so. And that would be like HIPAA violations, yeah,
right?
Exactly. Yeah, you do have to have permission to do that. And that applies to anything, but social media for sure, because it does get a lot of visibility and people will see that, and you might have people who recognize that person. It can be pretty embarrassing for somebody who doesn't want anyone to know that. And the other thing that was mentioned in that piece was that she was live streaming while doing procedures, talking to the camera, and it's pretty distracting when you're doing
right.
And some of these operations look very simple, but if you're not paying attention to what you're doing, you can cause a lot of injury. And one of the injuries that was noted in the article was what looked like an abdominal perforation, which can happen with liposuction if you're not paying attention.
Does that cringe you as a plastic surgeon to have someone performing procedures like that on social media and then doing harm? And your whole motto is do no harm as a doctor.
Yes, definitely. The thing is with social media, it's a great tool. You know, it's a great way to educate people. It can be entertaining without being a circus. And when people do that kind of thing, it does put patients at great risk. You know, the truth is, I use social media all the time, but in my practice, when I use it, it is primarily to educate people so they can see this is what a procedure looks like, this is what it does, and to do it in a way that doesn't put the person at risk.
And Dr. Kudrath, we know you're a social media king, but it's for your lifestyle more than medicine, more than procedures. So why did you say to yourself, I'm not going to do, because I'm an emergency room doctor, I'm not going to do that on there. I just want to show you, you know, some things that's fun.
Yeah, I mean, I do utilize social media to show what I'm doing. I find people find it inspiring, it gives them ideas. It also builds a network for me. But of course, in the ER, we're never going to live stream anything. We're always going to protect the patient's privacy. Now, that being said, with different cases like plastic surgery, some people want to see what the procedure is like. It makes them feel more comfortable. But like the other doctor said, there's better ways to do it than live streaming. This particular doctor has been warned before. She improved her paperwork, saying, oh no, I have permission from the patients to live stream it. But she was under the gun for a lot of things. Now, even if a surgeon does it perfectly, you can have a complication.
Right.
But when you start seeing more than the normal amount of complications, people are going to start looking at you. And when they're looking at you and you're being distracted by a live TikTok stream, that's not good. And could that have contributed to that bad outcome?
Absolutely. Now, Dr. Cuddy, when you put your stuff on social media, are you focused on the patient? Do you have someone else shoot it? And it's not I'm talking you through this.
Yeah, I don't do it in a way that would involve me doing a procedure, looking over at a camera, and talking to the audience and saying, hey, look what I'm doing over here, not paying attention to what I'm doing. So, yeah, you can have somebody else videotape it for you. You can use, there are all kinds of other devices like GoPro cameras are also another way to do it where you don't have to pay attention to it happening at all. But it's not the same as live streaming it really, but there are ways to document what you're doing so that even later on, what I do is narrate mostly, so that afterwards, once we got the video, we cut the video, and then I can narrate what's happening instead of trying to explain it while I'm doing it, which is just as functional as far as making sure that patients understand what the procedure is and how it's done.
Dr. Kudrath, if you walk into a doctor's office and all they're focused on is social media and like, let me put you on, would you be concerned as a patient if that's their sole focus and your life and your health and your safety is in their hands?
Yeah, personally, I would. I think when it comes to, these aren't minor procedures. These have a risk. And when you have something that has such a risk, you've got to give it your full attention. So if I think that somebody's going to do a procedure and be distracted, I don't think that would make me feel comfortable.
And really quick, tell us about the Atlanta case really quick in the last few seconds we have here.
So that was a dermatologist who was doing a BBL, butt lift operation, and was rapping and had backup dancers in the operating room.
On social media.
Yes, I think it was TikTok.
Rappers and backup dancers.
Yeah, while she was holding a scalpel. And she has had a number of bad outcomes. Eventually, I believe her license was revoked. But this is all done for the purpose of getting likes and getting people watching you, just wanting all that attention. And then you lose sight of what you're actually doing, which is taking care of somebody. Which really, that's what you should be focused on, not worrying about how many people like your videos.
Absolutely. Dr. Cuddy, Dr. Kudrath, thank you both for joining.